Hello, everyone. This is Sherry from the CGH Health Foundation, and welcome to our broadcast of one of our Growing Healthier programs. And these programs are sponsored by the Health Foundation about important health topics. And this month, we're very pleased to have Dr. Hatoum with us. He's the radiation oncologist with the Northern Illinois Cancer Treatment Center, a beautiful facility that we share with KSB. And next month in August, I'm really looking forward to Dr. Buddharaju talking about autoimmune diseases. I know they're very frustrating for some people, hard to diagnose. And so he'll be here on August 18th, live on Facebook to talk about autoimmune diseases. And we'll all look forward to that program too. I will turn it over to Dr. Bird and he can get started with interviewing Dr. Hatoum.
Hey, thanks, Sherry, and welcome everyone to Facebook Live this week, July 21st, 2022. Glad you could join us. Yeah, this is I'm looking forward to this one. And just once again, to be clear, this is a little different because normally I'm interviewing someone who works for CGH and actually NICTC, Northern Illinois Cancer Treatment Center, is a joint venture. It's actually owned by KSB and by CGH. So just so we're clear about that this is it's a partnership that resulted in NICTC, much like Northern Illinois Home Medical Supply. I probably butchered that one, but anyhow, the NIMS is also a joint venture between KSB and ourselves. So with that background information, let's get Dr. Hatoum into the conversation. Hi, Dr. Hatoum.
Hi, Dr. Bird. How are you doing today?
I'm doing well. Good to have you on this broadcast.
Thank you so much. Thank you for inviting me to speak about this unique specialty, radiation treatment, and the advance on that. Right?
Yeah, glad to have you. You know, the reason I have Dr. Hatoum on, to be honest with you, is it was maybe 2 or 3 months ago. I hadn't ever been in that facility, to be honest with everybody, and I was like, I want to take a look over there. And Dr. Hatoum and I were chatting, and he was kind of telling me some things that I was like, wow, I think we need folks to know about this. So as a result of that conversation, Dr. Hatoum is with us today, and I think you're going to find it really interesting, some of the things that are going on in radiation therapy, particularly as it pertains to what's going on locally in our area, which I think you're going to be. We do things here that you would do at a bigger center. So Dr. Hatoum, here goes. You ready for some questions?
Feel free to ask any questions, and I'm happy to explain about a few things that we do at NICTC, depending on the time frame.
Sure.
And it's good to educate anyone who can hear us now about this specialty.
Yeah, sure. So I'm just going to start with a simple question before we get into more details about the radiation treatments. But just in general, for people who have radiation therapy, what are some common side effects that they may experience?
That's a good question. So radiation therapy depends on the site of the disease that we are treating, depend on the how much that we are going to do of radiation. So sometimes the goal of the treatment will be definitive treating with the curative intent, or we have palliative radiation treatment. First of all, there are multiple kinds of radiation, some of them like coming from outside of the body. We call that external beam radiation treatment, and some of them but inside the body, like brachytherapy and seed implantation for prostate cancer, for example. So depending on the site of the disease, let me speak about the most common kind of cancer that we are treating nationally, and here specifically prostate cancer and breast cancer. So in the last few decades, the radiation treatment improved significantly, and everything now is computerized. Everything is specific. We are not treating anything randomly. We have a specific prescription, and it is specific guidelines, national guidelines that we stick with. And we are able to provide the best quality of treatment and minimize the toxicity to the tissue. For example, when we are treating breast cancer, so the most common side effects will be like a skin burn-like reaction. when you are like, for example, you go to the beach and you have that skin reaction. But with some lotion and with some um, treatment that we gave it to the patient, we were able to reduce that damage to the skin, and that the skin will be really in good shape at the end of the treatment. Also, you might notice some fatigue during the treatment, but that the patient are able to uh, do their normal activity every day. They come to our facility for like approximately 30 minutes, and then after that they can continue to work, they can continue to do to their normal daily activity. Speaking about breast cancer, also we have a beautiful technique at NICTC here that we use. We call that especially for the left breast, DIBH. That's a deep breath holding technique. We ask the patient to take a deep breath and hold it inside their breast and inside their chest, excuse me, and that will expand the lungs and push the heart away from the chest wall, and that would reduce the chance of toxicity to the heart, which is the most important thing now going on, because improvement of the quality of the treatment, we have to speak about the efficacy, and also we have to speak about the reducing the damage from radiation in the future. For example, we can see this picture. In the right hand, you can see how the heart away from the beam of the radiation, and on the left hand have
Yeah,
you
that's interesting.
see the heart, the radiation go through the heart. By asking the patient to take a deep breath, the heart will shift away from that beam of radiation, and the radiation damage to the heart will be close to zero. Um, Speaking about any another kind of cancer, the most common kind of cancer is the in the male human being is a prostate cancer. And during the course of the treatment, we take a high measurement to minimize the toxicity to the most important organs around the prostate. Speaking about that, rectum is just close to the prostate, and the bladder is just close to the prostate. And as a human being, we use those organs daily, multiple times to move the bowel and to urinate.
Sure.
And that's important not to cure the prostate cancer, but to reduce the damage to those critical organs. So here we take every day we do images. So our treatment with image guided radiation treatment, we do images every day to make sure that bladder is full and a little bit away from my radiation beam, and also the rectum is empty, and the rectum will be away from radiation treatment to reduce the damage. So with daily images, we'll make sure that the damage is as less as we can. And also we added something new to our facility that we used to, now we send the patient for a new technique, which is called like space OR, and that technique will reduce the damage to the rectum with 70%, and the quality of life for improve. For example, this picture for one of our patients, and if you can see, this is like axial view CT scan. The red line is the prostate gland, and the blue line is the rectum. And between those, you can see that contrast, which is hydrogel. This material will stay in the body for approximately 3 to 4 months, and it will resolve by itself. But
Okay.
the beauty of this material, it will create a space, if you can see, between this red line and blue line, and this space will give me a really nice margin to reduce the damage to the rectum, which is important.
Yeah.
And if you can see on the axial view, the next slide, we can see here the blue line is the rectum, the green line is the bladder, and the red line is the prostate. So the most important thing to deliver the highest dose that we can to the prostate, and to minimize the damage to the adjacent organ.
Yeah.
And you can see here how this blue, excuse me, the white material there, which is space OR, can create a space between the prostate and the rectum and reduce the damage. So with we're speaking about this, specific treatment would reduce the chance of the side effects. For example, for the prostate, we might notice some discomfort with urination,
Yeah.
or for sometimes loose stool. We can give the patient some treatment to improve the symptoms, and most of our patients can do their normal, really daily activity. Some of them work full-time job.
Yeah. So is that a surgical procedure then to get that area between your rectum and your prostate?
It is,
Yeah.
yes, it is. But it's like a 1 day procedure. It takes like about 15 minutes with the
Yeah.
expert urologist, so they can do the dissection and inject that between the
Yeah.
prostate and the rectum.
So yeah. So like Dr. Song, who's been on our show, would
Exactly.
inject that, and then it just the one injection, and then over a few months it will dissolve and by that time the treatments are done too. So that's pretty
Exactly.
cool. Yeah.
Exactly.
Okay. Can you talk about any other technology that NICTC has in place, and particularly it's put in place recently to help radiation exposure
Of course. So
patients?
speaking about the most common kind of cancer that we treat here, for example, lung cancer.
Hmm.
So we have a beautiful technique here, 4D CT scan. Let me speak about that, Dr. Bear, because this is a very important topic. As a human being, we cannot stop breathing during the
This is
treatment.
true.
So,
Yeah. Yeah.
so we have to breathe during the treatment, and during the breathing, our diaphragm move up and down, and with that motion, the tumor will move up and down or right and left. For that reason, we have a beautiful technique here, which is like 4D CT scan. The 4D CT scan, while the patient
You're
moves,
saying 4D, like 4 dimensions, not 3 dimensions, but 4.
exactly, the
Okay.
fourth dimension is the time,
Yeah.
because we have the circle of the breathing with the time, and we have to treat the patient within this circle of that time. And when we create the beam of the radiation, we have to minimize the damage to the adjacent organs like heart, lung, spinal cord. And that for the CT scan, when I draw the volume or when I do the beam, I can see by my eyes how much this tumor move up and down and create a smaller margin around that. And that will help me to treat accurately
Yeah.
and with to reduce the damage to the heart, to the lung, to the spinal cord. So for these CTs can really change the treatment for lung cancer. Usually, decades from now or years from now, it was like they do a big field of
Yeah.
radiation,
Right. Right.
and that will cause a lot of toxicity to the heart, to the lung, to the also to the food tube, the esophagus.
Yeah.
Um, so that is really a big side effects. And nowadays when we speak about more than 2 years survival for the patient with lung cancer, adding this beautiful systemic therapy, the immunotherapy, the chemotherapy. So we have to be careful about the damage in the future for those patients, because we cannot treat the cancer only and leave the patient struggle with the side effects from radiation. So nowadays we are very specific with less amount of radiation and less amount of damage to the adjacent organs.
Yeah. As you're talking about that, I'm struck by, even our last conversation we had, Dr. Hatoum, I was struck by the fact that it's NICTC is doing pretty much what you would do if you went to some big center. Can you kind of talk about that a little bit?
Exactly. So we are trying our best to do the same the treatment that we the bigger facilities around us that they can do to help our community and save their time, save them the trip. So closer, like university institute will be approximately 2 hours from here, and that is commute for several weeks. For example, prostate cancer more than 7 weeks, breast cancer 4 to 6 weeks. So We have a great staff here at NICTC. Our physicist did his training at my clinic. Our dosimetrist received his training and finished his training many years ago from MD Anderson Cancer Center. I did my training at Northwestern University in Chicago. So together we have a great team to provide the similar treatment and similar quality of treatment at our facility. And we are like now, we have a very nice technique that we have been using for several months, which we call that identification system. If we have like 2 minutes, I would like to speak about that, because
Sure.
this is like game changing, Dr. Bird. This
Yeah,
is
let's hear about it.
very nice, and that will reduce everything. And you know about medical mistakes. This will We have 100% accurate patients on the table, because we have a human being and we have mistakes. But with this identification system, we will not have any mistakes with the same patient on the same time and at the same position or the same site of the treatment. This is great. And I can show you this
Yeah,
nice
let's.
from Varian, the provider that we work with. Um, so this identification system, depending on infrared and multiple cameras that on the ceiling of the treatment room. And when we start to do the treatment from the beginning, from the CT scan to the treatment, it would show us the right patient, right location, and right setup. And we can watch the patient during the treatment. And if you can see here, the patient come and scan his hand to make sure that is the same patient, and it will give the direct information to our team that the patient is here and here's the site that we are treating. And on the monitor there, they will do that the camera will take a full screen to his body, and that body will be on our system.
Okay.
And during the treatment, if any movement happen, for example, we are treating the brain. See these cameras on the ceiling. It's any motion, you can see that whole body scan,
Mhm.
and this beautiful cameras identified. We have a checklist on our monitors to go through that. The same patient, same site, same treatment, and the same site of the disease, which is very important. Any changes to the site of the disease, or for example, if the patient during the treatment take a deep breath, the treatment will stop immediately. If the patient try to move his head or to move anything in his body, immediately that will shut the beam off, and that will reduce the toxicity. We are proud to have that system here in our facility, and that really nice like technology to minimize the damage to the organs. Because, for example, if you are treating a brain tumor and the patient tried to move a little bit, every critical organs like optic nerves, chiasm, and different side, it's millimeters from that area. So we are able to stop the radiation if the patient changed
Yeah.
the position.
Yeah, that is really impressive and really, yeah, very nice to be able to offer that for the patients in the area.
Mhm.
Um, I also I know that it's not just NICTC now, but you've developed relationships at NICTC with our local physicians who also treat patients who have cancers, and you collaborate with them quite a bit. Can you speak to that if you would too, Dr. Hatoum?
Absolutely. The time I came here, we created a nice relationship between us and the whole physician and around us. And we have a very beautiful oncology group. If I can say this, we are oncology group between CGH Hospital and the cancer care at KSP Hospital. So all of us meet every week to discuss the like complicated cases, to see what is the new things that we can provide to our patient. So if there's anything new, we share the thoughts and we make the right decision. We review the pathology, we review the images, we discuss the complicated cases between us here at CGH, KSP Hospital, and NICTC. I'm proud to say that it's not only my decision, so we have a group decision to treat this patient in the most accurate treatment plan, depending on the most recent recommendation from the National Cancer Institute and national guidelines. So all of us trying to help our community to have the best treatment option. And I'm happy to have our doctors at the CGH Hospital and KSP who are supporting us. And to tell the truth, sometimes at NICTC, we have really complicated cases. If I can speak about that for 1 minute.
Yeah, sure.
Sometimes we have a really complicated cases that need specific machine that we don't have it here, or specific technique that we don't have. That might maybe like 5% of the cases, less than 5% of the cases. So we have a great relationship with the bigger institute like Proton Center at Northwestern University, University of Chicago, University of Iowa. We have a great relationship with the doctors. If the patient come to us and we discuss his case and we found out that for some reason it's better to receive the treatment with a different machine, I immediately can speak with the doctors there and refer the patient to provide a better quality. So if we are able to do the treatment nicely, safely, with the best quality, we will do it. If not, in like less than 5% of the cases, like a very complicated cases, we can share that because they have, for example, we don't have a gamma knife here. We don't have proton treatment here. So sometimes some cases need a proton treatment or need gamma knife treatment. So we will help the patient also to receive the best treatment for their cases specifically.
Yeah. Dr. Hatoum, it's been really nice talking with you, and very nice job of explaining what goes on at the Northern Illinois Cancer Treatment Center. And I hope those of you who are watching this I'm just going to tell you, it's key in on the fact that what we have now at NICTC is not just an island in terms of this is where you get your radiation and that's that, but it is, thanks to Dr. Hatoum and the staff out there. Now you're coordinated with doctors in this area and at times outside of this area who are needed to help you in getting the treatments that you need for the cancers that you might have. So I'm really grateful to have NICTC in the area, and grateful for Dr. Hatoum and his team out there at NICTC. And yeah, it's been really our goal here is to educate and inform our public, the people that are in our communities that we serve. We accomplished that goal today, Dr. Hatoum. And so thank you, and appreciate all the work that you do.
Thank you so much. If you give me 2 seconds to just one thing. So the cancer treatment nowadays is different than before. So please, if you can go visit your primary care physician, do screening. The goal thing for us to do screening, mammography, early mammography will detect the breast cancer, PSA. Please see your primary care physician regularly. And if you have any kind of cancer, we are here to help with the best technology that we can provide. And early detection is the key to cure the cancer. Thank you,
Yeah.
sir.
Very good, Dr. Hatoum. Thank you so much. Yeah, he hit a home run with that last comment too about getting your screening testing done too. So great. I just have a few things I wanted to share with you before we go. As always, ongoing with COVID and what's going on with that. Just quickly, BA5, BA4, they're prevalent. They don't make you any sicker, But obviously right now there's a lot of folks that have that. So the more people that have it, the more chances there are for folks to be hospitalized. And yes, hospitalizations are up a little bit lately with COVID. Not like they were with some previous surges, but they're up. And, basically, I guess my message continues to be the same. You don't want to get COVID if you can avoid it. I wouldn't recommend going to COVID parties or anything like that. But still, go ahead and live your life with a couple caveats, and that would be get fully vaccinated. If you're over 50, get both of those boosters. Don't just stop at one, because we know that getting those boosters helps you from people from getting really, really sick. It doesn't necessarily help you from getting the infection, but from getting really, really sick from it. And if you have risk factors for getting really sick with COVID and you get it, reach out to your primary care physician and get set up with Paxlovid, which is an oral treatment, or some people need monoclonal antibody treatment, which we give here at the hospital. One way or another, if you have symptoms, you're positive, and you have some risk factors, please get some treatment to reduce your risk of getting really, really sick. I wanted to let folks know, I think we had something, I forget what it was, Matt, we wanted to say. Yes, thank you. So speaking of cancer care, here at CGH, we're going to have an open house for our new oncology space up on the 3rd floor of the main clinic. And that open house is going to be Thursday, July 28th, and you can see the time there. Public's welcome. We will ask that you wear a mask when you're there. But yeah, I'd love to have you there. And as a matter of fact, I'm actually going to do a field trip at that new space sometime between now and our next Facebook Live, which will be, I think it's August 4th. Is that right, guys? Whatever that first Thursday is of August. And actually, I'll do a quick COVID update, but then we'll show the field trip and kind of give you a chance for those people that weren't able to attend the open house in person to see a virtual open house with myself and walking through that space with others to kind of give us some information about it. I think that's what I wanted to share today. Thank you so much for taking the time to watch and become educated and informed about health-related topics here in our communities. And what else do I want to say? I forget. But anyhow, thanks for watching. We'll look forward to doing this again in a couple weeks, Thursday, the first Thursday of August, and we'll be here at noon. Until then, thanks. Bye.